My name's Burn-Murdoch. I'm a data journalist at the FT, where I've been for too long. No, I've been there for like 9 years now, which feels like a crazy amount of time, given that when I started I was like one of the kids. And so in my head I'm still one of the young people, but I think that's increasingly hard to defend based on evidence. But yeah, so I'm just going to talk about what I would sort of loosely term quantitative social science in action, sort of on deadline, what we do at the FT, and that's going to, a little bit of like what we do and how we do it, and then some case studies. But I want to start with talking about charts, because that I'm sure everyone in the room makes charts at some level, and I think it's like a really important part of what any of us who are doing data analysis for an audience, whether that audience is like your peers or the world. I think it's really important in sort of how we do that and how we think about it. So given that I spend an unhealthy amount of my time making charts, a good question to ask is why bother? And my convenient answer to that is that there's actually good evidence that charts are good at changing people's minds, and like relative to other ways of communicating with someone, a chart seems especially powerful. So I'm not just pulling that out of my arse, I'm going to give you some evidence for that. So this comes from a study done by a couple of social scientists, Brendan Nyhan and Jason Riefler, some of you may already know one or both of them, and they wanted to get to the heart of this question of when people are given a chart relative to when they're just given some text or a data table, are charts any more or less effective at getting information across? So they took a series of sort of semi-divisive statements, which were sort of falsifiable statements, and they then showed people either just the statement itself, or a paragraph containing some stats and numbers, or a chart, and then they said, do you still agree or disagree with this statement? And this being in the US, one of those divisive statements was a question of, is the world getting warmer? And so their control group were people, they just gave the statement, global warming is happening, and they said, do you agree or disagree that global warming is happening? And they took an audience of Republicans, given that that's the group for whom a statement like that is particularly divisive. They split them into either moderate or strong Republicans, and they said, do you believe global warming is happening? And you've got somewhere between a third and a half of Republicans there saying, don't believe global warming is a thing. And you're like, okay, that's not ideal, but that's our baseline. So now let's see what happens if we take those same people and we give them a paragraph with loads of data points, numbers in there. And it's a bit of a mixed bag. So among the moderate Republicans, maybe a few of them are persuaded. You go from half being skeptics to only about a third. Among the strong Republicans, there's maybe a little bit of evidence of a sort of backfire, and they sort of are presented with this information and go, damn it, like I refuse to believe that, I'm even more skeptical. In reality, I think with error bars, that probably looks more like no change in views rather than the backfire effect. But the point is, giving someone a paragraph containing numbers in it certainly didn't improve, or didn't have a major impact in reducing belief in a false statement. But then you give them a chart showing global temperatures over time, and among both groups, that skepticism or denialism, whatever you want to call it, plummets. So you've gone from, on average, about 40% of people saying don't believe global warming is happening to about 10%. And that's really striking. This is like a politically motivated group who have sort of partisan reasons not to believe this statement, but when you present them with a chart, they go, all right, fair enough. And so that for me is just pretty compelling. And there's been a couple of other studies on similarly structured studies recently that found similar things. So for whatever reason, we've sort of been, as a culture, we've come to treat charts as more reliable, more factual, more sort of stronger evidence than words. And one could argue actually whether that actually should be the case or not, but thankfully for me it is. So I sort of have a cheat code whenever I put a chart out, it's more effective than words. So that's the sort of why I do this. But then how do you actually make good charts? Like what makes a chart work? Why do some charts do better than others? And my position on this is that, kind of like with anything, if you're going to do something a lot, you want to become good at something, you have to think about, on a very basic level, what makes it good. And I think loads of people make charts without ever really thinking about what makes a good chart? Like, what's going to make this chart resonate with people, reach people, be memorable by those people? And I think this comes across as well in some of the resources that are out there for like how to make better charts. They tend to focus on really fine-grained things, like sort of pixel level changes to a chart, and not on like what I consider to be a much more fundamental question. Like the assumption in those materials is that when someone is reading a chart, they're taking out like a protractor or a compass or a ruler, and they're trying to sort of measure every pixel off your line chart to sort of read what number was behind it. Whereas in my experience, certainly, for most people, when they see a chart, it's more like they're at the cinema. They're sort of sitting back and just going, tell me what's going on. They're looking for a much broader picture, broader message out of your chart, rather than trying to work out what every individual number was. And that is a sort of lead up to saying something which I think, again, a lot of people in the data visualization space don't appreciate, is that words are actually really, really important to making effective data visualization. And again, this is not just a hot take, this is based on cutting edge research that's been done in this space. There's a team of researchers out of Seattle and Washington in the US who look at exactly this question of like what makes some charts resonate with people, what makes them memorable, that kind of thing. And this is a particular paper that I always go back to, where it's just a great experimental design for doing this. They said, we want to know why some charts just do a better job of conveying information and getting that information to stick with people than others. So they took hundreds of real-world charts, so things that might appear in the news or in textbooks or in I don't know, like government communications, that kind of thing. So these are real-world graphics, maps, charts, all sorts of things. And they said, all right, we're gonna show these to people for about 10 seconds each, so just a very quick glance. And that is that is our test of seeing, like, does this just grab you? Is this something that sticks with you? Then in the second phase, they showed the same images again, but only for a couple of seconds. So the idea there is you're just telling this, you're asking someone, do you remember this? Did this jog your memory at all? And then the final one, which I think is really cool, they then give them a blurred image and say, do you remember what the chart was saying? So you're measuring all sorts of things. It's, did this chart catch your eye? Do you remember what it was showing? Can you describe what it was showing? And they also did eye tracking on this. So they were also looking at what parts of a chart grab your attention when they're put in front of you. So I'm going to show you a little animation in a second from their study. And this is going to loop, so if you don't see it first time, hit on play again. And this is showing where people's focus went on one particular chart. So the focus goes up to the title, reads that, then comes down, and starts engaging with the actual content of the chart. So I'll just let that play through again. A chart's put in front of you, you go to the words, you read those, then you come down and see, all right, what's the actual content of this chart? And another thing they did was, at the end, when they'd asked people to then describe the charts in terms of what they remembered, they sort of tallied up every time someone mentioned a different aspect of the chart when they were describing it. And again, by far the most frequently mentioned thing was the title. People would say it was like some kind of bar chart, and the title said this, or the subheading said this, or there was a label saying that. So text was by far the thing that people remembered most when they were engaging with these charts, and it was what shaped what they remembered from the charts as well. And there's a couple of things there. One is to say that obviously this doesn't mean, well, why are we even bothering with charts then? Why don't we just do like a sort of snappy bit of text? Because as we've already seen, it's the presentation of something in chart format that gives you that extra sort of trust or cut through, and also, you know, producing something with that's colourful, that's striking, makes it more likely to stick with you than just putting some words out. But text is really important, and when you think about it, it actually makes perfect sense, because from the age of about 1, we're being taught to read. Like, we're being shown letters, and so we spend a very, very long time becoming extraordinarily familiar with these little shapes, like an A or a T or an S. So when we see something that is ultimately abstract, charts are abstract, like the bars and lines don't represent anything real, our eye is going to be drawn to the thing that we just recognise instinctively as a letter. So first of all, like, it makes perfect sense. And then, there's the fact that most people, and what I like to call normal people, don't see charts every day. Like, they're not taught to read charts. Like, I suspect most of us in this room, we recognise a bar chart or a line chart, maybe a scatter chart, that kind of thing. Most people, maybe like since the age of 16, probably dropped maths as soon as they could, didn't like that. And to the extent that they see charts now, it was the COVID pandemic, seeing those charts in the government's press conferences every day was probably the most chart-heavy media consumption they had in years. And the point is, if you show someone a chart and they are not one of us in this room, of course their attention is going to go to the words, because that's the only thing there that they instinctively understand. Like, the content of a bar chart or a line chart, you're kind of having to reteach them when they see these, because they might not see them for ages. And another demonstration of what I mean here, like what we think matters, or what most database people think matters in a chart, is just completely different to how non-charts people would consume a chart. So this was another really interesting bit of research from America. Again, they took loads of real-world graphics. They took them to rural America, so they're interviewing here people who worked in like forestry and mining and that kind of thing, not postgrad students. And they said, just tell us which of these, they gave people lots of sets of 2 charts and asked them to rank them, like, which do you prefer? And some of the feedback was stuff like this, where you've got 2 charts showing essentially the same data about drug overdose deaths in the US. Some of this is literally the same data, and then there's a couple of small differences. And this person said, well, I like this chart better than that one, because I live in America, so I thought it was relevant to me. The point is, it's the same data, and you can imagine reading a scientific paper or a piece of research that would contain this chart on the right, but because it doesn't explicitly say this chart is showing overdose death rates in America, a non-expert, someone who's just glancing at that for a second, they're like, don't know, it's some like blue squiggles on a white background. Whereas this one, they're like, well, that's overdose death rates in America. So something just, it's astonishingly basic, just putting a title on your chart that tells someone what that chart is, immediately makes, for the average person, for the non-chart person, it makes it a much better chart than that one. So that, there's reams of textbooks and online resources out there about like how to make slightly different charts, like how to use different tools, how to put confidence intervals on your line charts. But people aren't being told, like, put a descriptive narrative title on your chart, because otherwise you risk literally half of your audience switching off and being like, I don't know what that is. So yeah, I just can't overstate the importance of messaging, communication, text in charts. For me, whenever I make a chart, I'm thinking of it as a piece of communication. Like, sure, I've done loads of analysis and I'm displaying my results, but I've done all that work, so I want that work to get across to someone. So having a clear message, written message, is a really important part of that. So I'm going to talk briefly about sort of putting this into action at the FT during the pandemic, because I think some of the stuff we did in the early days was just like a perfect encapsulation of that importance of written messaging in charts. So this is an email that I got early March 2020, probably around like the 8th or 9th of March, from a colleague on the news desk. This was that time, ancient history now, where the pandemic had just started hitting the Western world. Like many other places at the FT, we'd been tracking the pandemic as it spread from China elsewhere in East Asia. But as it came into the West, Western newsrooms and Western society more generally started getting more concerned about it. So this was around the time when we were starting to get really scary headlines and pictures coming out of northern Italy. Things like ambulances rushing through the streets, or even like morgues getting overfilled with the number of people who were losing their lives. And so the big question was, all right, we've seen this take off in East Asia, we've now seen it look really quite alarming in Italy. Could we be next? And if we are next, then when, and what does that look like? And so I went away and pulled the data from Johns Hopkins University, who were just publishing like the daily case counts at that point, and just threw together like a super rough plot. This is just a ggplot graphic made in R, with like the number of days since the country had its 100th case along the x-axis, and then the cumulative number of cases vertically. So you could already see that whereas many countries in East Asia had managed to sort of flatten that curve very early on. To the extent that Italy was in a bad place, countries like the UK, US, elsewhere in Western Europe were all heading around that same trajectory. So it's a chart that really like speaks to that question everyone had at the time. But this is, you know, show this to 90%, well maybe not 90, like 80% of the population, and their eyes would have just glazed over. Like, this is just a sterile bit of data. It's not telling you, it's not shouting anything at you. Like, 2 years later, we can kind of look at that and go, yeah, I get what that's showing. And back in March 2020, the few sort of weird COVID nerds like me could look at this chart and get what it's showing. But this is not a piece of communication. This is a results graphic that you might include in a paper where you assume, or you know that whoever's looking at it already knows about the subject. So the first thing we did to get this sort of FT ready is just to style it up a bit. So we put it on our, what we like to tell ourselves is a pink background. I think anyone looking at that would tell us it's more like beige. I think pink just sounds cooler. And we've got our fonts, and like I've neatened up the labelling a little bit. But this is still quite a, this is still ultimately a chart for charts people. This is still asking you to know what a line chart is. The simple fact that the x-axis is not, it's not like dates or years, it's the number of dates since something's happened. That's not a chart type that many people would just instinctively get. So this is an improvement on the previous one, but it's still, I think, the kind of thing that if we published that at the time, it would have been fine, but it wouldn't have like really had the cut through that we ended up getting, and that's because we put text on. So you go from something where you, the reader, has to look at this for at least a few seconds to work out what it's showing, to something that tells you most Western countries are on the same coronavirus trajectory. Hong Kong and Singapore have managed to slow the spread. Like, that most Western countries are on the same trajectory was the single thing that millions of people in early to mid-March 2020 wanted to know. And even though that chart shows it, that chart tells it. Like, literally turning, you're going from a chart to a piece of communication. And then we've got, you know, these annotations as well, so that if people were wondering why certain countries had been more successful, we're able to sort of scratch that itch as well and give them that. And that, I think, is just why some of our stuff at the FT really took off, sort of came to some extent sort of dominate the COVID space early on, because all newsrooms and all sorts of people were making charts, but a lot of charts were a bit more like that, whereas we were really, really focusing on messaging. And some of the messages that I was getting in those early days, I think, bear that out, because I had like messages from school friends who I'd not spoken to in like 15 years saying, my mum just sent me one of your charts. And there's no way that's happening with that chart, is there? But you make something into a piece of communication, and it's a complete game changer. And important to note as well, I think there's two things here. One thing is, again, you're literally telling people what the chart shows. But in doing that, you're kind of teaching them how to read this chart. Because they might not instinctively grasp that this chart shows that most countries are on the same trajectory as Italy. But if you tell them that, then they go, oh, interesting, so those are the trajectories, and that's like passage of time, okay, so I get it. And then maybe the next day when you show them a similar chart, they have a better idea of reading it. So text really, really, really is critical. And there's a great quote, I don't know, I'm sure some of you would recognise the name Hans Rosling. He was a Swedish public health economist who did loads of amazing work, including a big focus on effective data visualization. And this was a quote he gave to the FT about 10 years ago, saying that as anyone who works as a visual communicator, so anyone who makes charts for some kind of audience, you have to be like the worst tabloid newspaper in the front and the Academy of Science in the back. So the point there being, at the back end, obviously you've got to do your work properly. Everything's got to be super thorough, super robust, you know, as scientific and nerdy and as not layperson friendly as it needs to be. But once you've done all that work, you should really not feel any qualms about being like, you know, the Sun newspaper in terms of how you get that message across. Put it in a chart, use bright colours, make a bold statement in a headline, because that is going to be what gets things through to people. There's no point spending days, weeks, months doing an amazing piece of work if you end up with something looking like that, and then no one's actually going to take it in, apart from like people reviewing your paper. So just a very clear lesson for us there at the FT that text and annotation add a huge amount of value for non-chart people, and most people are non-chart people. So when you make charts for people like us, you're really just limiting your addressable audience. And then there were some other fun things that came out of this chart as well. So some of you, especially people who saw this at the time or may kind of touched on it there, you might notice that the vertical scales here, it doesn't go 100, 200, 300, 400. We've got uneven numerical values and uneven spacing. That's because this is a logarithmic y-axis. And at the time, we thought we were being really smart. This was the right way to show data when you've got exponential growth, because an exponential growth on a log scale looks like a straight line, and we wanted to show that straight line trajectory. But people on Twitter, a lot of people on Twitter seem to be slightly thrown by that. And the point is, these aren't people who are just confused. There's a sense here that maybe the FT is like mangling the data, like what's going on, why have you done this? And that again was just a useful demonstration that even when there are sort of objective mathematical reasons for doing something, you risk massively confusing people, and that's not a good outcome. Like having people essentially distrust your chart is bad. But instead of thinking, okay, screw that then, let's go back and do things on a linear scale, there is a sort of middle way, which is to try and bring people along, like teach people what you're doing in situ. So being a Twitterholic, I obviously turned to Twitter, and I did a whole sort of explainer on this is why we've done this on a log scale, and because we were getting so many people coming back and looking at these charts every day, we ended up doing a video where we actually talked through here's what we're doing with this chart, here's why, and so on. And the cool thing about having done all that explaining was that what you then see is other people, this is like April now, so a few weeks later, other people replying to those initial people who were confused and saying, don't worry, it's a log scale, there's a video, it's cool. I love this one, just like, it's a log scale, it's fine. And the other funny thing I'd like to point to here is, if you can just about make it out, in the top left, the person who was confused by the log scale, their account is now suspended, and this account no longer exists. So I like to think that if you don't get log scales, basically Twitter's not for you.
But at Zucchini Cakes is all for you.
Yeah.
Howie W at Zucchini Cakes. Yeah.
Yeah, exactly. But yeah, so the point being mathematically right and correct is good, but if you're going to lose people along the way, that's bad. So there is a middle way, which is you just do that explaining of what you're doing, and the key thing is do it in situ, like wherever you're producing this chart that some people might misunderstand. Do that explaining right there next to it. There's no point doing something that people don't understand and then a week later in a different place saying here's how to read this chart. You've got to make sure you're hitting those same people. And so that, and I think the best evidence, again, for the point of doing that explaining is this next chart. So I don't know if people are familiar with Google Trends, so this shows like search interest in certain terms over time. And this is search interest in the term logarithmic scale, and that's when we started publishing our chart, and that goes straight up. So, there's correlation is not causation. But I think it is evidence that if you tell people, okay, I get that you're confused, what you're confused by is a logarithmic scale, and here's the case for that, then you're giving someone the material to go and learn more about it. If we just said, well, you're an idiot, it's like, how do you not understand this? Then that's a really negative experience. If someone doesn't get something and no one's there to help them, that line doesn't go up. They don't know what to search for, they don't do any searching, and they just go, oh, the FT makes weird, confusing charts. So the point is, make the chart. If people are confused, compromise, teach, bring them along. And that meant, millions of log scale charts must have been published over the last 2 years, and more people now understand them than would have done in March 2020. And don't get me wrong, I think we've gone from maybe 0.01% of the world understanding log scale charts to maybe 0.5% of the world. So most people still don't intuitively grasp it, but the number has gone up, and I think that's a good thing. So yeah, the point being, if people are confused by a chart you produce, that is your responsibility. I have no sympathy for people who are like, oh, how do people not get this kind of chart? It is on you, but you don't need to just scrap everything. You can just turn it into a conversation, bring people along, and it's really worthwhile. So now just to go into a couple of examples of more recent work at the FT and to go beyond just the sort of just the point of like charts for the sake of charts, but to talk about like why or how this is part of what we do at the FT. I just want to talk about a couple of recent examples of things I've worked on. So obviously, having come out of the pandemic, I've built up a lot of expertise in health data and just the sort of health domain in general, so that I've naturally gravitated a bit towards that. So one sort of phenomenon which started being a big deal in the summer and sort of June, July time, and has sort of remained a big deal since then, especially at the moment, is excess mortality in the UK after accounting for COVID. So obviously during the pandemic, many more people were dying than in a normal year for good reasons. But the puzzling thing is that in sort of May, June, July 2022 onwards, we're still seeing notable excess mortality even after accounting for the number of people who are still dying from COVID. And so this was a topic that I tried to sort of get to the bottom of, to unpick. And one thing I'll say here as well is I think all the data I'm showing you in this next little section it's all publicly available. So this is all stuff, that's generally how we work at the FT. Like, if data is not publicly available, then either it costs money, which we don't really have a budget for, or it's just not something we can get hold of at all. So generally this stuff is public. So the starting point for this was this is excess mortality in England and Wales, and then in all sorts of other European countries since the pandemic began. So one thing that I think just some people don't appreciate is that although the first wave of the virus in the UK was obviously really, really bad, other countries had, especially in Eastern Europe, had much worse, much more lethal pandemics from then onwards. But the key question here is what's going on at the end of the chart here on the right-hand side, where most European countries at this point were still showing excess mortality well into 2022, when we knew that this wasn't being caused by COVID. But part of the issue here is that this is a standard measure of excess deaths, which doesn't do any adjusting for the age structure of different populations. So given what we know about the risk of dying, people who are older ages have more risk of death from any given cause, and so if one country has a much younger population than another, then the same sort of external factor would produce fewer excess deaths, lower excess mortality in that country than one with an older age structure. So the first thing we had to do here was correct for that by using age standardised excess mortality. So that's where you say, if all countries have the same population age structure, how would this look? And what that does is it brings everything down towards zero, first of all, but it also shows that, relatively speaking, England and Wales are actually now further up, that they're more exceptional than what they would otherwise look like. And the only two other countries that were recording notable excess mortality at this point of time were Portugal and Spain. And what some people might remember, despite the weather today, is we had some heat waves during the summer. And while those heat waves famously obviously affected the UK, we were understandably very alarmed by the extreme heat that we got in July, but the Iberian Peninsula, Spain and Portugal had been having extreme heat, even by their standards, throughout all of June as well. So essentially, what you're seeing here, especially in Portugal, but to a lesser extent in Spain as well, was largely the impact of extreme heat. So if you put that to one side, then you get towards this situation where England and Wales is the only country in Europe at that point, and I believe that's roughly still the case today, with significant excess mortality once you adjust for age structure and extreme weather. So the question then becomes, well, why might England and Wales, the UK, be in this situation? And that's where we start to dig a little bit deeper. So these previous charts were showing total excess mortality, but now we can start to look at what can we attribute to COVID and what might not be COVID. So in this chart I'm showing excess deaths in the bars, and then the total number of deaths involving COVID in the grey area in the background. And what you see is that early on, those two followed pretty much the same pattern. But then as you get into late 2021, you start seeing those red bars extend above the grey. And by the time you get into mid-2022, the grey COVID deaths have dipped considerably, whereas you're still seeing those red bars. So if you subtract the area from the bars, you get this. This is the whether you've had more non-COVID deaths at any given time than usual or fewer. And essentially in the winters, we've been seeing fewer deaths than we would normally expect if there weren't a pandemic. And that's because part of that is because some of the measures we were taking to avoid spreading COVID, like wearing masks and social distancing, were leading to much less flu going around. And sadly, part of it is also because a lot of the very most vulnerable had lost their lives earlier in the pandemic, and so during winter, you saw fewer deaths than normal. But summer 2021, particularly summer 2022, we see these non-COVID excess deaths. So this is more people dying than usual, even after accounting for COVID. And so the question is, what's going on? And at first glance, it looks like a lot of this seems to be coming from heart and circulatory diseases. So heart attacks, strokes, that kind of thing. This is just in terms of the nominal number of people dying over and above normal, split by disease. But the problem here is you're not adjusting for what people die from at any given time. Because looking at this, you just say, well, it's mainly heart and circulation, so maybe that's knock-on effects of people who've already had COVID, because we know COVID can cause issues for the heart. But when you consider that actually, in a non-pandemic time, most people who die from those issues as well, and you turn this into proportional excess instead, then you see that it's much more broad-based. It's the heart and circulation, but it's also liver disease, diabetes, cerebrovascular diseases, urinary tract issues. So people are dying more than usual for many, many reasons. The things they're not dying from more than usual are things like cancer. So that, again, maybe makes sense because we know cancer is a progressive disease, it's slow-acting. Any disruption to healthcare in the last 2 years, which of course there has been a lot, is unlikely to have affected cancer death just yet. Unfortunately, it may do down the line, but not just yet. Respiratory diseases, because we've got no flu, you're seeing fewer respiratory deaths apart from COVID. And then neurodegenerative diseases, these are things like Alzheimer's and dementia, which again, unfortunately, many of those people lost their lives early on. But the point being, it's actually a very broad-based increase. It's many different health conditions that are causing those excess deaths. And then we start getting towards this explanation for what's happening, which is that we've got this complete crisis in emergency care, emergency medicine in the UK at the moment, where hopefully no one here has been unfortunate to need to go to A&E recently, but some of the waiting times in A&E departments, or waiting times for ambulances, are staggeringly high compared to normal. So people who have to wait 12 hours in A&E, that's now increasingly likely, like far more people doing that than usual. I think in June 2022, it was about 100,000 people in that month waited more than 12 hours in A&E, which is an astonishing number. And the reason that matters, what brings all this together, is that previous work has shown that the longer someone has to wait in A&E, the more chance there is of whatever reason they were in A&E in the first place, leading them to lose their life. So this is showing the sort of zero line here is the risk of death within a month of being at A&E for the average A&E patient. So if you're on that line, then it was if the red area here just went straight across, it would suggest that regardless of how much time you spend waiting in A&E, it has no impact on your risk of death. But what we actually see, of course, is that the longer you have to wait, the more chance there is of complications arising, and the more chance there is of someone losing their life in the month afterwards. So when you consider those things together, we've got far more people waiting either 4 to 12 hours or more than 12 hours in A&E than usual. And we know that long waits in A&E lead to an increased chance of mortality. You can overlay those two things on top of one another. We've now got this sort of maroon area in the background, which is the number of excess deaths you would expect from those increased A&E waits. You compare that to the number of non-COVID excess deaths we observe, and it's increasingly likely that those two are directly related. So again, this is not a perfect one-to-one relationship. We're not saying that the one completely explains the other, but there's now like a fairly good evidence base for the fact that what we've been seeing over the last few months, continuing to today, is that the the crisis in emergency departments and ambulances in the UK is causing this sort of steady, modest level of additional deaths compared to what we would see in a normal year, and that this is happening more in the UK, especially in England and Wales, than it is in other countries. So that's just a sort of classic example of the type of stuff that I work on at the FT. It's like take an issue that people are asking about, and it's, again, to this day, people are still concerned about excess deaths. Look at what data we've got that can sort of shed light on that. Combine that with things like academic research that's been done in the last couple of years, and see if that can tell a convincing story about what's going on. To give another more recent example, and one that gets slightly more into economic territory, another thing that we've been noticing over recent months in the UK is this rise of chronic illness and simultaneously a rise in economic activity, so people who are neither in employment or unemployed. And this, I think, is just, again, a really paints a striking picture of the extent to which the health situation in the UK is currently worse than other countries. Like, again, we've been through a pandemic. You would expect all countries to be suffering slightly, but this is the percentage of people on the left-hand side who needed medical care at some point in the last year and were unable to get it. So, just a basic level, a basic indicator of the functioning of the healthcare system in society. And you can see that in 2022, the UK there is has the highest rate of that. So essentially, it's harder to access healthcare if you need it in the UK than in any other country in Europe, and that's not just the EU, that's 35 other countries, and then the US. And if we look at why that is, the right-hand chart is essentially a sort of proportion of the left-hand chart. 7% of people in the UK, so about 1 in 15 people in the UK, in the last year, needed help, needed like a doctor's appointment or hospital appointment, couldn't get it, and that was because they were put on a waiting list. And again, that is much higher than what we see anywhere else, apart from Estonia, which I can talk about later, but the numbers there are obviously pretty crazy. But the point being, this is just, the NHS is famously free at the point of use, but if you can't actually use it, then that is kind of redundant. So, what does this mean for the population? What impact is this having on us? This kind of thing, being unable to see the GP when you need to, or get countries who spend a similar amount of fare seem to be faring better. But the big thing that does separate the UK from other countries is that we tend to devote a huge amount of our healthcare spending to the hospital and less of it to things like preventative care or residential care. So in other words, we're very good at putting resources behind directing resources at people who have become ill, but we're directing fewer resources in other countries at stopping people becoming ill in the first place. Another way of looking at that is the fact that the number of hospital doctors employed in the UK has pretty much risen in lockstep with the number of hospital admissions. So the demand for hospital treatment has broadly been met by increasing the number of doctors, whereas the number of GPs has dropped. We've got fewer people at that sort of community level preventing people from getting ill, but we've got more and more people treating the ill. And another thing that the UK's healthcare system does particularly bad is investment in capital, in infrastructure, in machinery, that kind of thing. So again, compared to similar countries, although we're spending a similar amount on healthcare overall, and especially on hospitals, the amount that we're putting into capital investment over a long time is way lower than what any other country is doing. And that means we have exceptionally low numbers of beds, exceptionally low numbers of bits of equipment like MRI scanners and CT scanners. So we have all these heroic NHS staff in the hospitals doing the best that they can, but they've got less equipment or older equipment than any of our peer countries, and it's that kind of investment that I think is going to be really crucial to getting the NHS out of the situation it's in at the moment. And yet, ironically, this is a time where the government is talking about cutting spending, particularly in things like long-term investment. So yeah, all of which is to say, to sort of recap again, I think the NHS the big challenge for the NHS at the moment is not necessarily just more money, although again that certainly wouldn't do any harm, but it's having a much more nuanced conversation about how the provision of healthcare could be restructured in the UK. I think there's this sort of blinkered view that we usually have in the UK where we think any conversation about tweaking the NHS means going to the American system, whereas in reality there are dozens of countries, including developed countries in the West, that have a system which is not exactly the same as the NHS, but is nothing like the US, and maybe that's where we need to go in the next few years to get to better outcomes. So yeah, that is a sort of brain dump of what I do at the FT. Hopefully useful to some degree.